Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Abatacept. This abatacept will bind to CD80 and CD84. This abatacept actually has an endogenous ligand. It has an endogenous ligand which is CTLA4, and it binds to CD80 and CD86, and thereby it inhibits binding to CD28, and thus it prevents activation of T cells. So, pharmacokinetics. Abatacept is given as an IV injection. It is a long acting drug with half life of around 10 days. The uses of abatacept is it can be used in refractory rheumatoid arthritis. The side effects are abatacept can cause infections or it can cause lymphomas also, and it should not be combined with other tumor necrosis factor blockers.
thank you and thank you for watching.